Okay, turning back now to the situation with coronavirus, and through this pandemic, we've been talking to our ABC analyst Casey Briggs about the situation both here in Australia and overseas. And Casey joins us now. Casey, good morning. So interesting news this morning, particularly in relation to Victoria. Another 14 cases, and 13 of those in relation to that abattoir.
Yeah, that's right, Joe. Let's talk about today's numbers and then maybe we can have a chat about the road forward in a few different aspects. But I might start with the rest, deal with the rest, and then we come to Victoria. 3 cases in New South Wales, 2 of those linked to Newmarch House. Queensland, just 2. Tasmania has reported 1 this morning. I'll just caution, that's not a final figure for the day. Usually Tasmania report in the evenings, and they've just said overnight that they have had 1. There may well be more throughout the day, so that number for Tasmania might still go up before day's end. And 14 now in Victoria for the day, 13 of which, as you said, linked to Cedar Meats abattoir in Melbourne. Now, that cluster with these 13 new cases now has 62 cases linked to it. It's actually a cluster that's almost the same size as the Newmarch House cluster now, 62 cases versus 68. You would hope that this cluster would be significantly less deadly though, just given the fact that it's a very different profile of people who are being infected, not elderly and vulnerable populations. So you would hope that we won't see the fatality rates that we're seeing in Newmarch House replicated at this abattoir, but I guess only time will tell. The other thing worth noting about this cluster is it's not just workers. Around half of today's new cases linked to that abattoir are also close contacts of those workers, so presumably largely members of families and immediate households, but the cases themselves have spread beyond just the work site, and so that's something just to watch to make sure all of those cases can be caught before they spread out into the general community.
But in his media conference this morning, the Victorian Premier Daniel Andrews was making a point of quoting the Chief Medical Officer of Australia, Brendan Murphy, saying that this had been very effectively handled.
Yeah, and look, they're catching cases very quickly. You know, we only learned about this cluster a relatively short time ago, and they're catching cases very quickly. We'd have to hope that means they're on top of it, not that there are many, many more to be caught. You know, hopefully that will be borne out by the numbers. There is certainly no reason at this point that I can see that you would say that, you know, the ball's been dropped, but, you know, let's wait and see what the numbers have to say.
Yeah. Okay, and a notable part of the media conferences this morning have been kind of everyone talking about Mother's Day, and it's a bit of a kind of a patchwork of different rules around the country in regards to Mother's Day.
Yeah, it really is. We know National Cabinet is meeting tomorrow. I think some were hoping that that might then lead to a relatively rapid easing off of restrictions, particularly for Mother's Day. We know Queensland, with its 2 new cases today, they're opening up in a very controlled way, I should say, allowing visits over the weekend and for Mother's Day. The interesting thing here, the other thing I should say is New South Wales and Victoria have generally indicated that they will not be doing the same. Every state's at a different point here. National Cabinet had agreed on a sort of baseline level of restrictions. Some states, like South Australia, didn't really stray too far from that. Queensland, New South Wales went quite a long way. Victoria went quite a long way. Queensland's now easing back. They're still not back at that baseline that National Cabinet had agreed. It's still there are still more restrictions on movement in Queensland than in South Australia. So it's just worth noting that the way Queensland's doing it is very controlled. You know, not just anyone can come over. It is one household at a time. And so then if there is transmission of this virus as a result of Mother's Day, well, we can still say then it's only been, you know, one household to one household at a time. And so it's going to be much, much easier to trace than if you were to just say 10 people can come over from all sorts of houses. Then you could actually have that rapid multiplying effect that authorities are still trying to avoid. The other thing I should say, Joe, is testing rates are looking really good, still increasing. You still want them to go higher, but 23,900, so that's the second highest number of tests results we've seen in a single day after just over a week ago. These are yesterday's numbers, I should say. We've seen really healthy numbers in Victoria for the last few days, very healthy numbers in New South Wales. So the fact that this testing rate is going up and apart from this one cluster, 2 clusters at Cedar Meats and Newmarch House, which are really dominating the figures this week, we're not seeing a corresponding increase in other transmissions. So that's a really good sign as well.
And a lot of anticipation about this National Cabinet meeting tomorrow. The Prime Minister had listed, I think there were 4 things he was going to use to judge, and all the leaders were going to use to judge whether restrictions could be further lifted. One of those was this app that's got about 5 million downloads. I think it'd be up to close to 5.5 million, I think, by now. But that's nowhere near to what their aim was of 40%. Would that seem to indicate that they may be kind of less optimistic than they may have been with the lifting of some restrictions?
Yeah, that number 40% has been floated by a few leaders at various points, and it's very unclear where exactly it's come from. The Senate hearing yesterday, Department of Health bureaucrats were saying it's not a number they were working with. I think the proof of the pudding of the app is going to be, at the end of the day, less in how many people have actually downloaded it, but how useful it turns out to be. And no health department is using this data yet. We need to sort of wait and see. It's a combination of how many people download it, how many people are using it, and using it to its most effect. You actually have to have it running and active for it to be of any help. So how effective is that? You know, that will then, and once we start to see it in use, which we're not yet, we'll get a bit of a clearer idea. At this point, I think it's still safe to say the old-fashioned contact tracing disease epidemiology is much more productive than the app. That may change as we go on, but you know, it's a big unknown at this point.
Okay, Casey Briggs there.